This is Ali. This is Achong. And this is Mutu. They are very similar. They live happily as neighbor. They go to Mama for dinner, but one of them have high blood pressure. According to research, about 1 in 3 adults have high blood pressure in Malaysia. Meanwhile, there are about 1 out of 6 adults that have high blood pressure in the world. What I'm trying to say is, a lot of people have high blood pressure, and I believe we can do better. My name is Epic Asian. Today, I will tell you what is high blood pressure. Welcome to Hi Doctor. This is a show where Epic Asian answer all your questions about medicine, health, and body. 医路有你，健康没问题。
High blood pressure, 高血压, a serious medical condition that can cause a lot of health problems.
What is high blood pressure? High blood pressure means that your blood pressure is high, also known as hypertension. Before we talk about high blood pressure, I will teach you how to take a proper blood pressure. Let's welcome my patient. When you look at blood pressure monitor, there are usually 3 numbers. Number 1, systolic, short form SYS. This is a big number. Normal value is around 120 mm mercury. Diastolic, short form DIA. This is a small number. Normal value is around 80 mm mercury. Pulse. This is the heart rate, 心跳. Normal value is between 60 to 100. To measure blood pressure, first, sit on a chair. Relax for a few minutes. Roll your sleeve and put your arm on the table, palm facing up. Put the cuff around your upper arm. Left arm or right arm, also no problem. Just make sure that the artery mark is closer position to the body because there is an important blood vessel to measure properly. The cuff cannot be too tight, cannot be too loose. Make sure you can put 2 fingers inside and you are very good. Stop talking for a short moment. This is important to get accurate blood pressure. Normal blood pressure is around 120 on 80. So, what is considered high blood pressure? According to the latest American guideline, Stage 1 high blood pressure is when the big number is 130 to 139 and the small number is 80 to 89. Stage 2 high blood pressure is when the big number is 140 and above and the small number is 90 and above. What are the risk factors and contributing factors of high blood pressure? In practice, many things can cause high blood pressure. For example, older age, obesity, family history of high blood pressure, eating a lot of salty food, alcohol, smoking, not enough exercise, and one very interesting condition called white coat hypertension. For example, when some people see a doctor, they become very anxious, 緊張, then their blood pressure become higher than usual when they see a doctor. There are also other more serious causes that I can explain next time. What are the complications of high blood pressure? Imagine this tube is a blood vessel. There is blood flowing inside this blood vessel. High blood pressure can make the blood vessel less flexible. When this happens, the blood vessel might rupture. So, high blood pressure can increase the risk of many other problems. For example, cardiovascular heart problem like heart failure, heart attack, and left ventricular hypertrophy. Kidney problem like chronic kidney disease. If it is very serious, you might need to go for dialysis, 洗肾, brain problem like stroke, 中风, and hypertensive retinopathy. That means your eyes become blur, cannot see clearly. How to treat high blood pressure? Every patient will have different severity of high blood pressure. That's why doctors should treat every patient on a case-by-case basis. But generally, there are a few things you can discuss with your doctor. Number 1, start with lifestyle changes. For example, you can exercise to lose weight. You can stop smoking. Number 2, diet changes. For example, you can consider eating the DASH diet, dietary approach to stop hypertension. DASH diet have a lot of potassium, magnesium, calcium, protein, and fiber. DASH diet have very little saturated fat, total fat, and cholesterol. That means you should eat more vegetable, fruits, low-fat dairy product, whole grain, poultry, and fish. Eat lesser salty food, sweet drinks, and red meats. Don't worry, you don't have to memorize everything. Generally, you just need to remember 3 things: low salt, low fat, and low sugar. 少盐, 少油, 少糖. Number 3. If you have confirmed hypertension and have increased risk of getting complication, your doctor will consider medicine. There are many classes of medicine, like ACE inhibitor, angiotensin receptor blocker, like calcium channel blocker. But remember, please don't simply take any medicine just because your friend tells you. Some medicine might work for one person, but the same medicine might not work for you. Moral of the story: many people have high blood pressure. Together with high cholesterol and diabetes, they can cause a lot of trouble. Please tell your mommy, daddy, auntie, uncle, 姨妈姑姐, brother and sister. Please be careful of their blood pressure. 医路有你，健康没问题。See you in the next episode.